What's good, family? Welcome back to the channel. If this is your first time here, don't forget to hit that subscribe button and share this video with everyone you know. What we're about to talk about is heartbreaking, shocking, and downright enraging. South Africans are being left to die on hospital floors, and now, in a rare and almost unbelievable twist, the government is admitting total failure. Yes, you heard that right. The very people trusted to manage our health system, the ones who swore oaths to serve and protect the citizens, are now throwing their hands up and saying they failed. The question now is, how many more lives have to be lost before we stop normalizing this national disgrace? Let's get into the raw truth. Hospitals across South Africa, from big urban centers to rural clinics, are collapsing right before our eyes. It's no longer just a crisis, it's a full-blown catastrophe. In Limpopo, patients have been found sleeping on plastic chairs, hooked up to 4 drips, without beds. In KwaZulu-Natal, viral videos are exposing scenes that belong in war zones, blood-stained floors, people moaning in pain with no help in sight, and nurses walking past patients like they're invisible. In Gauteng, hospitals are turning away patients because they simply have no space, no staff, and no equipment. And in the Free State, you'd be lucky to get a doctor before 3 days of waiting. The system is falling apart, and the government is no longer pretending otherwise. Health Minister Dr. Joe Fowler recently made a stunning admission. Speaking before Parliament, he confessed that the health system is in critical condition, that hospitals are overwhelmed, understaffed, and underfunded, and that citizens are dying unnecessarily because of these failures. He didn't sugarcoat it. He didn't spin it. And for once, he didn't blame apartheid, international sanctions, or invisible enemies. He looked the country in the eye and said, "We have failed." And while that level of honesty might be rare, it's far from comforting. Because this isn't about admitting failure, it's about living it. It's about the grandmother in the Eastern Cape who died in a wheelchair after waiting 19 hours to see a nurse. It's about the young man in Soweto who bled out in a hallway because no one could find a stretcher. It's about the babies who never make it out of maternity wards alive because incubators don't work, and power cuts kill what little hope remains. It's about families who walk into hospitals seeking help and walk out with body bags instead. People are angry. And they have every right to be. South Africa spends billions on healthcare every year. Government officials fly overseas for treatment while the public is left to fight for life with no doctors, no medicine, and no dignity. The corruption is obscene. Contracts meant to buy life-saving equipment are handed to politically connected ghost companies. PPE tenders during COVID-19 turned into feeding troughs for the elite. Instead of fixing broken hospital infrastructure, politicians are busy upgrading their offices and buying luxury vehicles. And when the public demands accountability, they are met with silence, spin, or worse, empty promises. The nurses and doctors are burning out. Many are fleeing the country for better pay and conditions abroad. Those who stay behind are demoralized, overworked, and often blamed for the very dysfunction they are trying to survive. Nurses are forced to make life and death decisions with no gloves, no oxygen, and no backup. Junior doctors are handling trauma cases without supervision. Security guards double as orderlies. It's chaos, and the people trapped in this broken system are the ones paying the ultimate price, with their lives. Let's talk about accountability. Where are the health mechs? Where are the provincial premiers? Where is the president? When last did Ramaphosa set foot in a public hospital, without a media circus or a sanitized tour? When last did any cabinet minister feel the pain of waiting 6 hours for Panadu or hearing the dreaded words, "The doctor is not in today, come back tomorrow"? There's a disconnect between the suffering of ordinary people and the comfortable silence of those in power. And the more this gap widens, the more dangerous it becomes. There are families who now fear going to hospitals, not because of disease, but because of neglect. The phrase, "you go in and never come out," is becoming all too real. And while communities are left grieving, government officials still get bonuses. Bureaucrats still smile for cameras, spinning health policy dreams that have no basis in reality. The National Health Insurance (NHI) bill is being pushed forward with great fanfare, but how can a system that can't keep the lights on run a national health scheme? If they can manage a single clinic, what makes them think they can run an entire nation's healthcare? But this isn't just about healthcare anymore. It's about human dignity. It's about justice. It's about the betrayal of trust. The Constitution of South Africa guarantees access to healthcare. It promises that no one should be denied emergency treatment. But walk into any township clinic on a Monday morning and you'll see that promise shattered before your eyes. The system is failing, and the silence is deadly. We are not just watching a slow collapse. We are witnessing a humanitarian crisis unfolding in plain sight. And it doesn't make headlines every day because suffering has become too common. We've normalized the abnormal. We've become desensitized to images of people lying on hospital floors, to video clips of cockroaches crawling over patients, to screams that echo down hallways no one bothers to clean anymore. That's the real tragedy. So now that the government has admitted total failure, what next? Will this be a turning point or just another headline buried in the next scandal cycle? Will Parliament act, or will they hold another useless inquiry that goes nowhere? South Africans are tired. Tired of words. Tired of spin. Tired of watching their loved ones die because someone in power forgot how to care. If this isn't the wake-up call the country needs, then what is? Thank you for watching, fam. This one hit hard. If you're as heartbroken and furious as we are, make sure to like, share, and comment below. We need to talk about this. We need to keep the pressure on. And above all, we need to demand better. Subscribe to the channel for more raw truth, and don't stay silent. The voices of the people must be louder than the failures of the state. Until next time, stay safe, stay loud, and stay woke.